The Zika virus has been in the news a lot lately, and I thought it would be worthwhile to get a better understanding of what the Zika virus is and why there's concern about it. And to learn more about it, we're going to speak with Dr. Matthew Leibowitz, who is Chief of Infectious Diseases at Newton-Wellesley Hospital. Dr. Leibowitz, thank you so much for coming on. Appreciate it.
You're welcome. Thanks for having me.
Let's start, if it's okay, by talking about how a virus differs from other illnesses. I have medical professionals in the family, and I still don't fully comprehend how a virus is different from, say, a bacterium.
Virus is an organism that some people would doubt whether or not it's really alive. It requires some other kind of cell to replicate in. So whereas bacteria can live on their own in the environment or live on their own in other hosts like people or animals, that viruses, although they may persist in the environment and may go through other animals as part of a transmission chain that they end up infecting humans, that they're incapable of living free in the environment on their own without other animals or organisms' cells to grow in.
And help us understand, if you would, what the Zika virus is and what type of virus we're looking at.
It's a virus that is transmitted by mosquitoes. So whereas some viruses like influenza, that's also a big concern around this time of the year, is transmitted person to person, the Zika virus is transmitted by mosquitoes, the Aedes mosquito that is common in the tropics, but is also present in some parts of the United States as well. And it's similar to a couple of other viruses that have been known to be transmitted by those kind of mosquitoes, dengue fever and chikungunya fever, which is also mostly tropical illness.
We're speaking with Dr. Matthew Leibowitz, Chief of Infectious Diseases at Newton-Wellesley Hospital, about the Zika virus. Now, there have been some warnings issued. I was going to say travel bans, but they're really not travel bans. They're more advisories to places in South America. Why don't you talk a little bit about why those are in place?
So the travel recommendations are not, I wouldn't say they're outright bans, but they're recommendations to be cautious, and it's not really at the level where they've banned all non-essential travel to the areas that have been impacted. But it's largely the biggest concern is that certain people will be at risk, like pregnant women. And in general, the viral infection itself from Zika virus is a relatively mild infection. It's a mild illness with fever and joint and muscle aches, a rash, and sometimes red eyes or conjunctivitis. Those are the main symptoms. And many people who get infected with the virus are not really all that sick, and maybe up to 80% of people really don't have much in the way of symptoms at all, even though they really have been infected through the bite of an infected mosquito in a part of the world where it's common. But the real concern is that there have been all these cases of impacts on fetuses, that pregnant women have been infected during pregnancy and then given birth to babies who had potential for neurologic problems, particularly microcephaly, where there's been some impact on brain development during pregnancy that could have a potentially devastating effect on a pregnant woman and her developing child.
You pretty much answered this, but I was going to ask you, if we should be worried about this, and clearly for pregnant women there's concern. But apart from that, is it kind of like other viruses that have been around already?
Yeah, it's similar to dengue fever and chikungunya, which are known ones that have been transmitted viruses by these same types of mosquitoes in the same area of the world, pretty much, where it's been an increasing concern in South and Central America and the Caribbean, that in general, these viruses will make some people really sick, and most people will not be too sick when they get them. And if you do travel to parts of the world where these viruses are present and the mosquitoes that transmit them are more common, the major thing is just to try to prevent exposure to mosquitoes and prevent mosquito bites. So use of long sleeves and long pants, and as well as mosquito repellents like DEET-containing repellents are the most effective ones. Those measures will reduce the risk of being exposed to these viruses pretty well.
We're talking with Dr. Matthew Leibowitz, who is Chief of Infectious Diseases at Newton-Wellesley Hospital. What does someone do if they end up getting the virus?
Unfortunately, with these, there's no, other than avoiding mosquitoes, there's no prevention, so there's no vaccine for it. The people who are symptomatic with some kind of illness, whether it's fever or muscle aches or rash, headaches, usually they would end up going to see a healthcare professional at some point, whether it's urgent care or emergency room or primary care physician, that along with the recent travel history, usually the onset of the illness is usually within about 2 weeks of travel to the area, parts of the world where it's common, that if they were recognized as having it and it was suspected, unfortunately there's also no specific treatment for it. There's no antiviral medication. It's really just supportive care, so hydration and pain control and just waiting it out. And overall, Zika virus is relatively mild, so the average non-pregnant person who would get it would really not have much concern for any severe disease or any kind of long-lasting impacts of infection.
Please forgive me if this is not a smart question, but does the virus stay with you, or does it eventually make its way out of your system?
So in the vast majority of cases, it's thought that the virus is completely cleared fairly quickly, and there's no known significant risk of transmission person to person. That's commonly thought to occur.
Where did this virus originate? I know there's all the news about South America. Is that where it started?
It didn't actually. The first cases were from Africa, and then it was increasingly recognized in other parts of Asia and tropical islands in the Pacific as well. And this spread to the Western Hemisphere, South America, Central America, and the Caribbean in particular. The first cases in South America recognized in Brazil. This is a new phenomenon, and I think it's probably that the mosquitoes that are capable of transmitting it have always been around in the Western Hemisphere, and with increased travel and people coming from other parts of the world and bringing the virus along with them, mosquitoes then pick it up and transmit it from one person to the next. That with increased travel, that's probably why these kind of viruses are becoming more in the news as they spread to parts of the world that they haven't been seen in before.
Do you think when it gets warm here and the mosquitoes come back out, we're going to be dealing with it with a much bigger problem?
I think in the tropical areas, these mosquitoes are around all the time.
Right.
I think the big concern as well is there are mosquitoes that are capable of transmitting this in the United States, and the one thing that's unknown is in the warmer parts of the United States and in the warm parts of the year, could there be possible transmission via mosquitoes that occurs in the United States, between people who have not traveled to South America, Central America, and that's yet to be seen. I think there's going to be ongoing surveillance for new cases in the United States to establish where the infection came from, and it's not impossible, and it's been on the CDC's radar for a while that dengue fever, there have been cases that are thought to be transmitted in the United States as well, in Texas or other parts of the United States, that there's ongoing watch to make sure that we have an idea of what kind of transmission is going on in the United States potentially. So
the best advice is, if you're going to be living amongst mosquitoes, long sleeves and make DEET your friend as well.
Right.
Dr. Matthew Leibowitz is Chief of Infectious Diseases at Newton-Wellesley Hospital. Thank you so much for helping us learn more about the Zika virus. A lot I think that most of us don't know about the virus, although it certainly has been getting a lot of press.
Yeah, I mean, these kind of things. Zika is definitely in the news, and these kind of. I mean, it's exciting, and the other tie-in that's of interest is, with the Olympics in Brazil. I think there's a lot of concern.
Right.
There's
a
lot more people coming to Brazil and bringing it back to their home countries anywhere around the world. But that who knows how that'll turn out. But I think still this gets into the news and people get worried about it, but we get tired of the boring old diseases like influenza, and getting the flu shot is probably way more important step that people could take to protect their health than worrying about Zika virus. But this is hot and it's in the news, so people think about it and they wonder about it, and I still think it's probably more important people do good things like wash their hands, get a flu shot, but
thorough hand washing, things like that. Sure.
Right.
Well, thank you so much. I feel like we've learned something this morning. I appreciate your time.
You're welcome. Take care.